a teamwork concept. Success rate ranged between 73 and 93. A return to previous activity level and full recovery is based on many considerations. Successful ACL surgery has 5 arms: pre-operative consideration, operative, post-operative, return to play, and the prevention of re-injury. The first arm is prehab, and the prehab improves the post-operative recovery. So the better you are going into surgery, the better you will be coming out of surgery, okay? The preoperative optimization, I mean the prehab, reduce swelling, get motion, get quadriceps strength. This is preoperative. Reduce swelling by ice, compression, non-steroidal anti-inflammatory, aspiration if needed. Get motion, flexion and extension. أنا همشي سريع لأن المحاضرة طويلة. Get quadriceps strength by quadriceps drills, تمرينات, و closed kinetic chain. Operative consideration, make the correct diagnosis, recognize any associated injuries, posterolateral, posteromedial, all ligaments, menisci, and cartilage. Timing of reconstruction, time is not as important as the condition of the knee at the time of surgery. Should have full range of motion, minimal effusion, minimal pain, and mentally prepared. Avoid the use of tourniquet. This is a recommendation because of decreased thigh circumference by tourniquet and delayed quadriceps activation, right? Still in the operative consideration, the right graft for the right patient. The ideal graft should produce the anatomic and the biomechanical properties of the native ligament. Also allow solid fixation and rapid biological integration with minimal donor site morbidity. To date, no graft fully meets all these requirements. All are strong enough, okay? Correct tunnel position, it should be anatomic, not too high, not too low, should be anatomic, and the posterior wall is about 2 to 3 millimeters. No multiple ways for fixation of ACL, okay? Fix the meniscus when possible, especially the medial, because lack of medial meniscus places too much stresses on the ACL reconstruction. Consider anterolateral ligament reconstruction. I will leave this for the Dr. Muhammad Sobhi. You will speak about this, as far as I remember. Immediate post-operative consideration, reduce swelling, early physiotherapy, reduce swelling by cryotherapy and compression. We miss something like this. We have, not used. It should be. Early physiotherapy restores the range of motion, strengthen while protecting the graft. Early motion, activate quadriceps and strengthen the hamstring. Just activate the quadriceps and strengthen the hamstring, okay? Get early physiotherapy, get extension early. Again, get extension. If don't get early, then hard to get. Use extension device if having trouble. Get on bike, greater for knee range of motion, great for quadriceps, minimal stress on the ACL. And then the fourth arm is return to play. When to return to play, to play? No clear-cut answer. Time of return to sport. Young athletes who return to sport before 9 months after ACL reconstruction have a rate of new injury 7 times that of those who delay return. The optimal time for return to sport after ACL reconstruction remains an ongoing debate. Return to sport criteria, 5 P's criteria. This is from my own thinking. The first is physical criteria. The second, psychological criteria. The third, performance criteria. Fourth, proper imaging criteria. And finally, play criteria. هناخد واحدة واحدة. Physical criteria, no pain, no swelling, symmetrical range of motion, and good stability. Psychological criteria, fear of pain or re-injury due to movement, kinesiophobia. 50% of non-returner in Mon study cited fear of re-injury. A well-balanced and motivated athlete performs well. Sport psychologists can play a huge role in recovery. This is very important. Performance criteria, quadriceps and hamstring strength should be more than 90% of the non-involved limb. ودي بتتقاس بالمايومتري. أجهزة معروفة للقصة دي. Hop index more than 90% of the non-involved limb. Plyometrics اللي هي عبارة عن speed and strength together. Optimal neuromuscular control. Sport-specific training. Finally, proper imaging criteria to prevent graft re-injury, safe return to sport at the proper time when the graft completely healed. MRI is an indirect assessor of graft maturity. وده اللي احنا الحقيقة ماشيين بيه. The lower the significant intensity, the more mature the graft. بنشوف الجرافت بيبقى لونه اسود قوي، يبقى اوكي زي هنا here. لكن الافضل بقى الحكايه دي الحقيقه MRI signal to noise coefficient is better than MRI signal intensity. Initial increase in SNQ peaking at 6 months followed by gradual decrease over time. وبتتقاس الحقيقه بالطريقه دي. انا جبتها من بتوع الاشعه، لكن يعني وان كنت مش فاهمها قوي، لكن هي كويشن لازم تتعمل. يبقى ACL اللي هو region of interest equal signal of ACL number 1 minus signal PCL2 on the background noise. background noise اللي هو الاير طبعا، ده بيبقى ليه لون معين. Play criteria, return to practice game entails gradual increase time, intensity up to 100% effort, gradually. Progress from game simulation, friendly game, to competitive match. وبرضو يعني شوي. Prevention of re-injury after ACL reconstruction. Proper warm-up اللي هو التسخين قبل الماتش prior to technical and tactical training. Enhance performance. Continue neuromuscular training for the remainder of their career. To summarize, successful ACL surgery and recovery: first, pre-operative consideration, operative, post-operative, return to play, no hurry, 5 P's criteria, and the prevention of re-injury consideration. Alhamdulillah, thank you.